No such thing as a healthy smoker. Smokers who think they are escaping the lung-damaging effects of inhaled tobacco smoke may have to think again, according to the findings of two major new studies, one of which the author originally titled Myth of the Healthy Smoker. Chronic obstructive pulmonary disease, or COPD, may be among the best-known dangers of smoking, and current and former smokers can be checked for that with a test called spirometry that measures how much air they can inhale and how quickly they can exhale. Unfortunately, this simple test is often skipped during routine medical checkups of people with a history of smoking. But more important, even when spirometry is done, the new studies prove that the test often fails to detect serious lung abnormalities that cause chronic cough and sputum production and compromise a person's breathing, energy level, risk of serious infections and quality of life. Current or former smokers without airflow obstruction may assume that they are disease-free, but that's not necessarily the case, one of the research teams pointed out. These researchers projected that there are 35 million current or former smokers older than 55 in the United States with unrecognized smoking-caused lung disease or impairments. Many, if not most, of these people could get worse with time, even if they have quit smoking. They are also unlikely to be referred for pulmonary rehabilitation, a treatment that can head off encroaching disability. Perhaps most important, those currently smoking may be inclined to think they've dodged the bullet and so can continue to smoke with impunity. Doctors, who are often reluctant to urge patients with symptoms to quit smoking, may be even less likely to recommend smoking cessation to those with normal spirometry results. Referring to COPD, one of the researchers, Dr. Elizabeth A. Regan, said, "Smoking is really taking a terrible toll on our society." Dr. Regan, a clinical researcher at National Jewish Health in Denver, is the lead author of one of the new studies, published last year in JAMA Internal Medicine. "We live happily in the world thinking that only a small percentage of people who smoke get this devastating disease," she said. However, the lungs of millions of people in the United States are negatively impacted by smoking, and our methods for identifying their lung disease are relatively insensitive. Even when the results of spirometry are normal, Dr. Regan added, a lot of smokers have respiratory symptoms. They get sick often, are more likely to be hospitalized with bronchitis or pneumonia, and have evidence on CT scans of thickened airway walls or emphysema that impair breathing.